My name is Eric Wang. I'm an assistant professor at the JAX laboratory in Connecticut. And our research focuses on understanding mechanisms of drug resistance in a disease known as acute myeloid leukemia. So acute myeloid leukemia is a hematologic malignancy. It's primarily in adults and has a very poor prognosis when it comes to treatment. So relapse remains to be a major issue in this disease. In leukemia patients, still one of the primary forms of treatment is chemotherapy, specifically the 7+3 chemotherapy regimen. Really, the problem right now is that there's no treatments for patients that relapse. And I think that's why our study is so important. It's not just to understand what isoforms or genes that mediate resistance, but how we can target this in the future. Our study really focuses on a biological process known as RNA splicing and how that contributes or modulates chemo resistance and relapse. And there's been a lot of studies on emphasizing on genes itself, but what's less studied are kind of the splice isoforms that contribute to modulating this response. I think this is extremely relevant, especially for JAX genomics medicine, primarily to develop therapeutic strategies for a broad range of diseases. The use of these antisense oligos is also of much interest to JAX rare diseases as well. So if we could develop or optimize these ASOs, these can be also used for other diseases as well, not just AML.